Now, when I talk about the things that are injected into it, I mean, the Huneke brothers in the 1920s or so started off with, I believe, lidocaine, moved on to procaine, local anesthetics, right? And that's the most common. Is that what you're using in your neurotherapy injections?
Well, what I use varies from patient to
Okay.
patient. Uh, Neural therapy was developed in the 1920s. Uh, they're actually celebrating the 100th anniversary at a
Oh, yeah.
conference in Frankfurt this summer.
Nice.
And at the time, procaine or novocaine was the only local anesthetic that existed.
Mm,
And so classical neural therapy involves the use of what's called implatal, which is a combination of procaine and caffeine.
wow.
Uh, but procaine is considered the sort of the standard by purists.
Yeah.
That being said, there are doctors who are using other local anesthetics and reporting good results. And I'm a very evidence focused person wherever I can find it, whether it's, using the evidence I see in front of me or using the evidence that's been published. And I think there's a really good case to be made for all of us who are doing neural therapy to document what we're using and what we're injecting and crowdsourcing that data so that we can figure out whether one drug is better than another or one approach is better than another. Right now, what I use in my practice is based on what patients respond best to with energetic testing.
Mm,
And so some patients will get procaine, other patients will get lidocaine or bupivacaine or ropivacaine. And lower concentrations seem to work just as well, which is great because they're more gentle for patients, less risk of complications. And I'm also often using a little bit of dextrose
mm.
to augment neural therapy. Uh, you've definitely talked about prolotherapy before, and this started with higher concentrations of dextrose, like 25%, sometimes up to 50%. And then about 15 years ago, a doctor from New Zealand named John Lyftogt introduced PIT, perineural injection technique, using 5% dextrose, injecting into superficial nerves. So I sometimes will use a local anesthetic, sometimes I'll use dextrose, and sometimes I'll use both. And then there's a regenerative medicine approach. Some docs are using PRP and stem cells in joints to regenerate tissues. And there's another fraction of the blood, it's called PPP, platelet
Yep.
poor plasma, which seems to be more uh, helpful in healing inflamed nerves.
Hmm.
So, I think the neural therapy paradigm is not so much based on what you're injecting,
Yeah.
but on what lesion you're treating.
Right. And what person has that lesion as well, right? Trying to match it. It's a very individual, and again, it's an art form in many ways. And I know European doctors that use homeopathic remedies, even, trying to give the information to that area along with lidocaine. And again, that just adds another element to it of what you have to work with the person in front of you to do so. Now, for those listening and saying, okay, this sounds great. What can I expect afterwards? Is it kind of instant resolution and I feel, suddenly better? Or how many sessions will I need? Obviously individualized, but what are you seeing in the patterns of patients and in the improvement and what to expect?
It depends how long you've been sick,
Yeah.
and it depends how complicated your problem is. If you have a multi-system picture that's been going on for decades, uh, it's likely that you'll need a few sessions to see lasting, meaningful results. But there was something called the lightning reaction, which is sort of an immediate disappearance of a long-standing problem with a single injection or after a single treatment. And that's something we still see routinely. You may see a shoulder pain that disappears when you inject the gallbladder scar,
Mm.
or you may see a neck pain that disappears when you inject a tooth. And that can sometimes be in one visit. But the thing that's interesting is that it's not so much like a cookie cutter approach where this treats this and that treats that.
Right.
You're looking at the regulatory system as a whole. And it's not just the nervous system. It's the what I call the pine system, the psycho, immuno, neuroendocrine system. It's like one matrix that it's like the software, the operating system of the body.
Yeah.
And anything, any lesion anywhere can create any problem anywhere.
Right.
But the patterns that we see tend to be more following the pathways of meridians. And so that's a useful guide in my practice. I do a whole body approach, and it's rare for patients not to leave feeling great. The question is, how long does it last?
Hmm.
If the symptoms come back the next day, then typically there's something we missed and we need to dig deeper.
Right. And again, you're being an inquisitive artist in this all and sensing it. And sometimes when you peel back a layer of an onion, another comes up. And so it's a continuous, and that's why you can't look at it as a one-to-one A plus B equals C. It is this kind of quantum reality of it that you could have so many things that will come through, but through resolving one at a time, you will get back to health or at least homeostasis.